Hello, and welcome to today's webinar on partnering with community. For decades, the population and economic fabric of Allen County, Kansas has been declining. The trend has taken a toll on the health of the community. But residents of this rural southeastern Kansas county banded together to foster a sense of belonging and to enhance the livelihoods of all residents. In 2017, Allen County was recognized for the transformation in their community with a Robert Wood Johnson Foundation Culture of Health Prize. At the heart of the community's efforts to improve health is a commitment to authentically engage and partner with the community's best asset, its people. Today, we're going to talk with Lissa Regier, Deputy Director of Outreach and Advocacy for Thrive Allen County, about how the nonprofit coalition creates opportunities for residents to embrace their power and to act collectively. I want to acknowledge that the County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. My name is Karen Odegaard, and I am a community coach, and I'm joined today by a great team of colleagues. I'm going to introduce folks and ask them to jump on and say hello. So let me first welcome Erica Burrows-Girardi, a fellow community coach. Welcome, Erica.
Hi, welcome to the webinar, and I will be answering any questions that you put into the Q&A box.
Great. And of course, Lissa Regier, Deputy Director of Outreach and Advocacy for Thrive Allen County.
Hello,
Welcome.
everyone. I look forward to talking with you.
Thanks, Lissa. And also Joe Hinton, our community learning coach, will be helping behind the scenes on chats and questions. So just a heads up if you see his name popping up.
Good afternoon, everybody.
Thanks, Joe. And one more, James Lloyd is helping us out with technology today, and we appreciate his help. So if you run into any problems with Zoom, please let us know, and James will help to make sure that you're able to stay connected.
Thanks, Karen. Welcome everybody to the webinar.
Thanks, James. So by the end of our time together today, you can expect to be able to describe how Allen County, Kansas has partnered with community, to reflect on why engaging community members, especially those most impacted by poor health outcomes, matters to you, and to identify at least one way you can partner with community residents in a more authentic and meaningful way. I also want to share that there will be an exciting learning opportunity after the webinar today. Immediately following our webinar, we're also going to be hosting a post-webinar interactive discussion group to deepen your learning. So these post-webinar conversations give you a chance to be face-to-face with other attendees, to share what you're doing locally, as well as ask questions of other participants. And we're very excited to be offering these sessions in partnership with Healthy Places by Design. Joanne Lee, who is with Healthy Places by Design, will be our lead facilitator today. And Lissa is also planning to join us to talk more with us about some of the learning outcomes that we just shared, as well as any other topics or questions that arise. And she may have a few questions for you as well. So watch the chat for details about how to connect later in the webinar. Let me start our conversation today by laying out a little bit of our why. Why do we here at County Health Rankings and Roadmaps exist? Why do we produce the rankings, the tools, and the resources that we do to support communities? County Health Rankings and Roadmaps has two primary overarching goals. The first is to improve health outcomes for all. This includes both how long people live and how healthy they are. Our second goal is to close the health gaps between those with the most and least opportunities for good health. We believe that everyone should have a fair opportunity to be as healthy as possible, regardless of where we live or the circumstances we're born into, and that the choices that we make depend on the opportunities we have. So things like access to healthy food or quality education, living in safe and affordable housing in crime-free neighborhoods. But not everyone has these opportunities. These unequal opportunities to create differences in health, these unequal opportunities create differences in health. and they don't come about on their own or because of the actions of individuals alone. Instead, they are often the results of policies and practices at every level that have created deep-rooted barriers to good health for some people. So I want to stop for a moment and ask you to think about your own community. Who isn't thriving? Who doesn't have the same opportunities for health? What barriers have been put in place over the years? And importantly, what will it take to remove those barriers and change the opportunities in your community? As we'll hear from Lissa in a moment, in Allen County, they saw the opportunity to cultivate relationships and partner with their community as a way to remove barriers and to change opportunities. Now we'd like to hear from you. What relationships or partnerships could you cultivate to begin closing gaps in your community? Use the chat feature to share what comes to mind for you. I'm going to encourage you to chat to all attendees so that everyone can see your responses. So let's think about what this means. What do we mean when we talk about health equity? And we like to paint a little bit of a picture with this. So imagine a place where everyone has a fair and just chance to lead the healthiest life possible. A place where barriers have been removed. This might be a communities that have high quality schools or good paying jobs. They have access to healthy foods and quality health care and affordable housing in safe neighborhoods. Imagine a place where the differences in race, culture, and perspectives are not only tolerated, but are actually celebrated as fundamental to health and well-being. Imagine that this is how we all experience our communities, regardless of where we live, the circumstances we're born into, or how we look. This is the vision of health equity. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. So I want to check in with Joe. I can see that folks have been chatting a bit, and I'd love to hear, Joe, what are you seeing about the relationships and the partnerships that people are thinking about cultivating?
Yeah, we've got a lot of excited people thinking about the bridges that can be built between different agencies and organizations, having hospitals partner with schools. Tammy lifted up that idea. We had the idea from Shannon of more faith-based relationships in community. Laura gave us a nice list of community stakeholders thinking about senior centers, churches, offices on aging. So just really thinking about all of those stakeholders and partners that are in the community as a way to have a better vision for health equity.
That's great. Those are great ideas, and I see that they're continuing. Do continue to share with and if you weren't quite sure yet how to respond to that question in the chat, that's okay. But it's something that you may want to be listening for today. So as we're talking today, I'm going to encourage you to keep this question in mind. How can partnering with community members help you to improve health outcomes and increase health equity in your community? Now, before we head into our conversation with Lissa, I'd like to take a moment for a quick poll. I'm going to ask James to help us get that set up. So I'd like to hear how you're currently partnering with the people most affected by poor outcomes in your community. So take a look through these descriptions. Which one best fits your efforts? Maybe you haven't yet involved people most affected by poor outcomes. Or you might be getting their input, but they're not really directly involved yet. You may find that people are most affected by health outcomes are engaged in your work, but they don't have leadership or decision-making power yet. Or you may find that you actually are ensuring that people most affected by poor outcomes are partners in every part of your work, and that they have leadership roles and decision-making power. So we've got about half of you have voted or responded to the poll. That's great. And we'll just give it a second more, and then I'll ask James to close the poll and share the results. Hopefully we'll be able to share them so everyone can see this. Great. So a really nice mix here. You see that a lot of you are in this work. You are working on engaging those most affected by poor health outcomes, and maybe thinking about ways to get them more involved as decision makers and leaders in the work. And a few of you are there already. So we'll look forward to having all of you chime in the chat afterward in the discussion group to share your own insights. What things are you hearing from Lissa that really resonate with you or that make you think about something that you've done that has worked? We want everyone here to feel like they've got expertise to share, and you can do that using the chat. So this is a great mix. And Lissa, we are excited to hear from you. So I'm gonna stop sharing these results, and I wanna take a moment to introduce Lissa to all of you. I've said her name a few times. I'm gonna say it again, full name. So I am excited to introduce Lissa Vergeer. Again, Lissa is the Director of Outreach and Advocacy for Thrive Allen County. Now she oversees Thrive's efforts to build a statewide rural health advocacy network in Kansas and coordinates engagement with state and local policymakers. She has overseen the Thrive's Navigator program, building it into a regional force that has reduced the county's uninsured rate from, I want you to listen to this, that has reduced the county's uninsurance rate from 21% in 2013 to 9% in 2017. This is one of the biggest improvements in Kansas, and I think an incredible accomplishment. Lissa, thank you so much for joining us, and welcome.
Thank you, Karen. Hi, everyone. It's so good to be here with you today. And I want to do a quick shout out because I saw in the chats that we have quite a few Allen County people who are listening as well. So yay, Allen County represent. So I thought we'd start today with just a quick geography lesson for those of you not in Allen County or even in Kansas. As you can see on your map, Allen County is located in southeast Kansas. We are made up of a population of 13,000 people spread over 505 square miles. Southeast Kansas in general has often been referred to as the Appalachia of the Midwest. A lot of our population tends to be poorer, less educated, and have much worse health outcomes than our counterparts in other parts of the US and even in other parts of Kansas. So with this information in mind, a group of Allen Countyans got together and said, we don't want people to continue to think that tomorrow will be worse than today. And they didn't like the trajectory that they saw our community headed in. And so they formed in 2007, Thrive Allen County. And we started with one staff member who is our CEO, David Toland, and he started in 2008. And in the last 10 years, he has grown us from a staff of 1 himself to a team of 11. Our focus areas are health and wellness, recreation, education, and economic development, which was added in 2013. And I think that piece makes us a little bit unique. Our vision is that Allen County will be the healthiest rural county in the state of Kansas. We have a long way to go. I'd like to say I have a lot of job security right now. We are currently number 84 out of 105 counties, but we have moved up the list. We're continuing to make progress and move the needle in the right direction, which was why we were recognized last year by the Robert Wood Johnson Foundation as a 2017 Culture of Health Prize winner. And we were so honored to be a recipient of that award and to be the first Kansas community to win that, that honor and distinction.
That's great. And we know that, because we know you well from the prize award, we know that Thrive puts a great deal of focus on community engagement.
Yes.
So can you tell us a little bit about what that means to you and how you got started with that?
Yeah, so when Thrive began, we knew we couldn't come straight into our community and say, hey, we know what's best for you. We believe that's a really good way to turn people off of you and your organization in a heartbeat. what we knew we needed to do was go into our individual towns and our county and really get to know the residents and what they wanted to see in their communities. And so we started doing community conversations in each town in Allen County. This gave every town the opportunity to tell us what was important to them. We started out in Elsmore, who I know is on the call today, I saw that, a town of 68 people, and at that first meeting, we had more than 45 people show up out of 68. And there's a reason for that. No one had ever gone out to them and asked them what they wanted. When we sat down with them and introduced ourselves, they came and they wanted to meet us. And so we said, hey, we're Thrive Allen County. Told them just a few things about ourselves, but that's not what we were there for. We were there to learn from them. So we opened it up and said, what would you like us to know? You know what they told us? Nothing. It was crickets. We learned early on that we had to be very comfortable with silence. We had to be comfortable with letting people sit and get comfortable with us. And so after a little while, someone did raise their hand. An older farmer said, you know, I know this isn't what you do, but the county hasn't been mowing our ditches and we really need to get them mowed. It's dangerous. Now, most people will tell you, stay mission-centered, don't veer off course, but we don't believe in that and we don't adhere by that, because if your community is your mission and their progress is your vision, then you need to listen to what they're asking for. So we told them we'd take care of it. And the next day, we called the county office and said, Elsmore needs their ditches mowed. And sure enough, they sent a mower out there. They got the ditches mowed. And in that one move, we were able to put a deposit in what we call the trust bank. We listened to them and we followed through with what we told them we would do. So the next time we went out to Elsmore for our community conversation, we introduced ourselves again, asked people what they wanted to see, and this time a hand went up faster. People had some more ideas. They said, thanks for getting the ditches mowed. We really appreciate that. We've had a stop sign that's been down for a while. It's really dangerous. It needs to get put back up. Do you think you can do it? Again, it's not part of our mission, but we needed to continue to build trust with this community. And so we said, yeah, we'll get it done. We'll figure it out. So we went back, called the county office again, said, hey, that stop sign has to go up. And it did. And another deposit got put in that trust bank. So the third time we went out to Elsmore, we didn't need to introduce ourselves. They knew who we were. And when we asked them what they wanted to see in their community, it shifted a little bit. And a hand went up and somebody said, you guys do health stuff, right? Well, it takes us more than 30 minutes to travel to a doctor's office to get a flu shot. Do you think there's any way you could get a mobile flu shot clinic out here? And just like that, we're finally speaking the same language, which was really exciting. And we had put enough deposits in the trust bank that we were starting to see a return.
I just love this idea of the trust bank. I think that really can resonate with people. And you can imagine the kinds of things that you might do to put deposits in the trust bank with the communities or the partners you're trying to connect with. Now, I heard you highlight 3 key ways to put deposits in the trust bank. You talked about practicing good listening to find out what was important to the members of the community. And then you delivered on promises, which meant that you set your mission and priorities aside to help achieve what was most important to the community.
Yeah.
And this is the one that I think we sometimes, that gets left behind. I heard you talk about staying the course, that you returned to the community multiple times. I mean, you were there for three separate meetings. That was an investment in time and patience. But you were there ready to listen because you were putting deposits. Your objective was to put deposits in that trust bank and to build connections.
Right.
Now, I know that Allen County has had a lot of wins over the years. How has your partnership with the community evolved, continued to evolve from these early days of community conversations to maybe some more recent examples?
Yeah, so one of the things that I'm very proud of here at Thrive is is that we love having community members come in and share their dreams with us, and they do that because they believe that we can help them turn them into reality. And so we take a lead role in working with them to bring those dreams to fruition. And we like to say we don't do the work, the residents do the work. So we take our lead from them. And an example of this would be in the city of Moran. It has a population of 500 people, and a couple of years ago they decided that they wanted a fitness center, but they didn't know how to get it. So they came to Thrive for guidance and support, and we worked with them throughout the process, but they let it. They found out that the owner of the no longer used gas station was willing to let them use his building for free. They worked with Thrive as we wrote them a grant for equipment for the building. And the residents worked with their city government to come up with a payment system where the fee for their membership, a whopping $10 a month per household, would come directly out of their utility bill. They came up with a key fob system to allow for easy entrance and negating the need for an employee that they were concerned they couldn't afford. So the fitness center came to life because the community wanted to see it happen. And after they got that win, it cemented in them the fact that when they come together to work on something, they can make a positive difference in their community. So fast forward, just a couple months after the fitness center opened, Moran residents became aware that their small family-owned grocery store owners wanted to retire, but they couldn't find a buyer for their store, meaning that their local grocery store would likely shutter their doors. And that was unacceptable to this community for very good reasons. And so the community rallied again. And this time they rallied to create a food co-op. And they came to Thrive, and we worked with them on writing grants and figuring out the how-tos and forming a food co-op, because this is something we've never done either. We were able to bring on a Vista employee who had done some work with that, so we were able to provide support in that way. And the residents held events like God, Country, and Groceries, where they combined musicians and food to raise memberships for the co-op. And it didn't take long for them to reach their goal, which was 100 members at $100 a membership. And in just over a year, which honestly was a time frame that blew us away, they had turned their local grocery store, as you can see on the bottom right, that's Stubbs Market, they turned it into the Marmonton Market Co-op. And that's Allen County's only member-owned grocery store. And that was able to happen because residents got a win under their belt, and it inspired them and empowered them to believe that they could do so much more than just save and preserve their community, but they could grow it.
Oh, what a great story. One of the things I love about this particular story is it highlights a different way that you've partnered with residents that goes beyond asking for their input like you did in Elsmore, which is important. It's a really important thing to do. But in Moran, residents took the lead and built on their own successes. And it sounds like you really stepped in to play a support role. You weren't the expert. You weren't the leader.
Right.
I think that's it's a powerful way to work with a community to help them understand and embrace the power that they have in their own community to improve their own community.
Yeah, I think if you're talking about true resident-led initiatives, you have to be comfortable taking a supporting role.
Yeah. I can see out of the corner of my eye that the chat is, there's a lot of activity there around this idea of a trust bank. I know Joe posed a question to them, so I want to just pause for a moment and ask Joe if you can let us know a little bit about what you're seeing there, about other ideas that folks have to build up the trust bank.
Yeah, there's lots of great ideas going on, and thinking about that idea of a trust bank. You know, how we communicate with our communities, how we survey, how we do questionnaires, how we can be active listeners with our community. A lot of great ideas about showing up and showing that you're there. And when you continue to show up, the community continues to show up, so that true engagement can happen.
Yeah.
You know, I love thinking about active listening. Veronica's comment came through on active listening, and I always want to challenge myself to think that way too. So some great ideas. I hope they continue to come in.
Yeah, that's great. Thank you so much for engaging there and listening to Lissa's story as well. So Lissa, what's happening now? What's the most recent happening in Allen County?
Yeah, so for one of our current projects, we're focusing solely on the city of La Harpe, which is the poorest community in Allen County. La Harpe, like Moran, has 500 residents, but their community makeup is very different. We are currently doing a deep dive into La Harpe, working on health equity issues and empowering residents to overcome barriers through building capacity with them by teaching them grant writing skills and inviting them to become civically engaged, providing leadership training, and connecting them to resources that they might otherwise be unaware of. Our big question when starting in La Harpe was, how do you build trust in a community where you don't know many people and they are mistrusting of outsiders? I won't go into the minute details of how we did that, although I will say that Damaris Kunkler, who leads this project, will be joining us in the following session. And she'd be such a fabulous resource for those of you looking to ask really in-depth, detailed questions about engaging with any kind of community. Actually, she does all of our community engagement work, so she'd be fabulous for you to talk to. So definitely come to the next session. The biggest change that we implemented in working in La Harpe was in the way we interacted with the community at large. So instead of a big community conversation, which is kind of what Thrive has been known for, we began with real talks. Real, in this case, standing for reaching equity in all lives. And these were conversations that were had with a group of 3 to 5 individuals, usually friends or family members. And Damaris, who I said, again, leads this project, she would facilitate these conversations, and she'd take a stenographer with her to capture the information from these informal conversations about how the residents viewed their community, what they were concerned about, what they'd like to see changed, etc. And what she found out pretty quickly was that every group has a dominant voice, meaning there's always going to be someone that the rest of the group defers to and maybe even shapes their answers around. And that wasn't helping her get to the issue of really answering these questions surrounding equity. And so Damaris shifted gears and she tried another tactic. And she began meeting with residents one-on-one, like Ross, who you see on the right-hand side of your screen. Damaris met with Ross, as she did with many, many, many residents in La Harpe. And she learned of his opinions of the community and was able to share with them what she had learned in meeting with other community members, which was something that Ross was unaware of, that there were senior dinners going on monthly and he knew nothing about them. So now Ross gets to attend those senior dinners where he is not only able to socialize with others, but from what I was told, he can kind of become the life of the party, which is great because in rural communities, especially amongst our elder population, social isolation is a real problem. And so being able to make these connections that Damaris is able to make on these one-on-one conversations where she really gets to dig deep into how people are doing, what they'd be interested in, where she can connect them to other resources, it's not only important, but it can be life-saving. So after Damaris had a lot of these one-on-one conversations, we were able to bring the residents together again, and she had gained this trust from them and from her countless real talks, and we were able to shift back into a community type conversation where we were able to ask residents to dream about what they'd like to see in their community, and they came up with all kinds of ideas, and we were able to put these ideas on a wall, and you can kind of see them in these pictures. The pictures at the bottom are kind of them, breaking ice with each other. There's a little rock, paper, scissors going on there and having conversations. But what you see at the top is where they have written all the ideas down on these huge notepad pieces of paper, and then each resident was given 3 stickers, so they could put a sticker on each one of the top 3 ideas that they wanted to see, further fulfilled and carried out in their community. And so that has now become the list of projects that will be moved forward as these Harpe dreams come to fruition.
That's great. You are clearly learning so much in the work that you're doing in La Harpe and all across Allen County.
Yeah.
And the thing that I really appreciate is that the lessons that you're identifying are very specific to the communities that you're talking about here. So, Damaris learned some very specific lessons about what was going to work in La Harpe, but those lessons are also applicable to many communities.
Yeah.
And one specific lesson that I heard you highlight is the power of one-on-one conversations. That these one-on-one conversations with residents help to build trust and lay the foundation for them being able to work together to create change. I think that's a really great takeaway for folks to consider. If if you're in a community that you're struggling to get people to be honest, to get the real answers, the real talks that you're trying to learn about from the community, that maybe shifting from community meetings or focus groups to these one-on-one conversations could be very revealing and help to build that trust up.
Yeah, and I will add,
just
really quickly, Karen, apologies.
That's
Part of that, building that trust, you have to have the right person in there to build that trust. Damaris was definitely the right person to be in the community. She has a huge heart for Allen County in general, but she is just someone that, you innately trust. And so you have to make sure you're putting the right people in those communities to make those connections.
Real quick, Lissa, do you have, I think that's a really important point. And has Thrive learned any lessons about that? Like, how did you find Damaris? How do you find the right people?
Damaris found us, actually, and she came on before I did. But Damaris is from Allen County, but had moved away, and she came back, and she knew what David was doing at Thrive, and she loved it. She has, like I said, a huge heart for our community. Those are the people you want involved in your work, because to Damaris and myself and other people that we have on staff here, when we go out in the communities, it's not work. It's fun, because we grew up here and we want to see it continue to grow and thrive long past our time here for our children or our nieces and nephews. And so finding people who have that desire to better their community, not because they think it's going to gain them accolades or because it's going to give them a title bump in a position, those aren't the people you want. You want the people that can sit down and especially in rural communities, they have to feel like you're a part of them and you're not just, coming in, sitting down, gathering information, leaving. You have to stay in that community and you have to continue that work with them and continue to build that trust over time.
Yeah, that's great. We want to leave time for questions. So I want to ask what tips you have for others who want to partner with community residents in a more meaningful way.
Yeah, so the first thing I would share is what we talked about when I was talking about Elsmore, which is build up the trust bank. So make sure your community knows that you're listening and actively listening and following through on what you say that you will deliver, because the last thing you want from them is to close their account with you, because you're probably not going to get it opened again. The next thing is really ask the right questions. Understand who it is that you're working with, who's going to be affected by what you're working on, because those are people you need to engage with. Are you working on a project where the people you really need to connect with are government officials or business owners or community leaders? Or are you working with your residents regardless of skill or title? Who has the influence on the issues we're trying to address? You really need to make sure that you're cultivating strong relationships with residents and with decision makers. With your decision makers, it can be government officials, it can be school administrators, it can be property owners. Either way, you really need to make sure you're aware of who really influences those issues that you're working on. And then one of the biggest things we look at Thrive is who is or could be a champion on the issue that you're working on. This is one of the most important things that you can do. And in my opinion. Find the people in your community that are really passionate about your project area. At Thrive, we understand that we cannot be the people who are always on the forefront championing issues. It has to be the residents themselves who are out there saying, we want this done. So if we can find someone who's excited about what we're working on, and then that person rallies their friends and family to join them, then there's really nothing better than that, because they become the spokesperson in a way that they can carry that torch for you and push things forward. And honestly, it should make your job a lot easier if you can find that person.
Yeah.
And I might add too that you really need to understand what kind of issue you're working on. So if you're trying to create an event or a project, or you're working on new trails, then a community conversation is probably your best bet. But if you're really looking to figure out health equity issues, you won't get the answers you need from a community conversation where people don't feel as safe sharing their struggles. One-on-one conversations where people aren't as afraid to speak their minds, and where they're more apt to share the barriers that they see in their communities, those would be your best avenue. And then meet people where they are. And I mean this both physically, like I talked with you about in Elsmore.
Yeah.
Meet people in their own communities where they're comfortable and where you're on their turf, and meet them where they are on issues as well. So maybe they're not as far along as you'd like them to be in their thinking on a certain issue or project. That's okay. Learn where they are and respect where they are, and work to bring them forward with you through a respectful process.
Yeah.
And then the last thing I would say, and definitely not the least, celebrate. Celebrate. If your residents are anything like our residents in Allen County, they work hard day in and day out, and they never, ever expect any form of recognition for that work. So recognize them. If what you're trying to do is change the mindset of a community, you need to work on pointing out the positives. So whether that be in a formal awards dinner like we hold every year at Thrive and just had on Friday night, where we highlight all the great things that happened that year, or a ribbon cutting. We love ribbon cuttings, and so do your community members because it shows progress, or a fun event, or it can simply be by highlighting wins and successes in your community, or small everyday acts of kindness that you see in your community that equal positive advancements in people's deeds and their thoughts. Share that on social media. Share it, share it, share it, share it a lot. And make people believe that things are changing for the better. It's amazing what can happen when your residents feel like they're seeing positive change after positive change after positive change. Yeah. It starts a windfall of more positive changes that will grow from outside of your work. And that's really when you know you've impacted the mindset of your community, when the change starts happening outside of you. And celebrate that too.
Yeah, I love this. And I know you've said a couple of times that part of your work is to help residents in Allen County believe that tomorrow will be better than today. Yeah. One of the things that strikes me about your story, and every time we talk, I get like goosebumps about it, because it's so clear how your community has built capacity among residents, so they don't just believe that tomorrow will be better than today because of somebody else's actions, but that they actually can make tomorrow better than today. They have the agency to make positive changes in Allen County. And that's the part of the story that I think is just so important for people to hear, is that sense of giving them that agency, or letting them see it again in a new way.
Right. I don't think you can get a community turnaround like what we're looking for if you as an organization are the only ones doing all of the work. You've got to empower your residents to feel like they can change the direction of their lives and the community that they live in. And that, I think, is what makes all the difference.
Yeah. We're going to pivot to questions in just a moment. But I know that Joe had also started some chat conversation around this idea of finding the trust builders in your organizations and your community. And I haven't been able to follow it closely, but it looks like there's been some activity on it. Joe, can you just tell us a little bit about it?
Sure, we've got just a lot of people who are very active and thinking about a lot of different ideas. So, I would lift up that a lot of people were just really lifting up Lissa's idea of there being a snowball effect. That when someone is doing the right thing, whether it's an organization or whether it's someone in the community, that more and more people become active in that, and the momentum and the idea. Tammy lifted up that success breeds success, and I think that's a really great idea for us to think about when people in the community start to feel empowered.
Yeah.
Yeah, and I would also add to that, what we've noticed is, with the advent of social media, it's very easy to get wrapped up in negative things as well. And so what we do is we grab that negativity and we try and push it over here and we say, okay, but here's the really good stuff going on. And so really to counter that, you have to remember that you guys are leaders in your communities. People look to you. They're listening to what you say. So you have to be very careful about what you put out there as well, whether it's on your own social media or whether it's when you're talking to a reporter or putting it on a business page, whatever it is. We can really work to try and control is not really the word I'm looking for, but there's so much negativity that just exists. We want to highlight just all the good stuff that's going on and really make sure that people are looking positively at what is happening, because there's so many wonderful things.
That's great. I can see that we have a lot of questions coming in, so I'm going to ask Erica to jump in and let us know what kind of questions you're seeing here.
Yeah, first of all, thanks, Lissa, for sharing that story. It is truly inspiring. I know that you don't have access to the chat box, but I will let you know folks are blowing it up, talking about how inspiring this story is. We've had a lot of great questions. I don't think we're going to have time to ask them all live, so I just want to be upfront with you. And then at the same time, encourage you to come to the discussion group that will follow this webinar, and it'll start immediately. Joe will be chatting out the link for that soon. So plan to come to that discussion group to share your questions and ideas about how you're working in the community. I am going to start, Lissa, by asking you a couple of questions that actually came to us when people registered, because you can ask questions when folks register as well. So this person from Lubbock, Texas wanted to know, how do you engage folks that aren't yet invested in a collaborative idea? So like maybe they just haven't seen the vision yet. How do you get them to be motivated to do that?
Yeah, I think there are a couple of things to think about here. One is, really work to engage them. A lot of people aren't engaged because they're not asked, or they're not asked in a way that gets them excited about what you're doing. One of the things we did at Thrive a long time ago is we abolished committees. We said, people don't want to be a part of committees. It's too time consuming. And instead what we did is we started figuring out where people's passions were and involving them with that. So if they love working on trails, then that's what we have them do. And we don't ask them to come sit in a committee that talks about, how are we going to do this strategic thing over here? And so we've worked really hard to make sure we're only asking people to do things that they're really passionate about. And so I guess with that question, the two things that come to mind are, make sure you're really asking. A lot of people don't get involved because they're not asked. And more than just like an email, but like a face-to-face ask. And then two is really figure out where their passions lie. And if part of what you're working on can fit in with part of what they're passionate about, because if it can, then I think you'll be able to make that connection, and you'll have someone who's really wanting to be involved instead of just like you're dragging them to be part of a group and they're begrudgingly coming because maybe they feel like they just should be involved. Those aren't really the people you want. You want the people who are excited to be involved.
I love that idea about really just honing in on people's passion. And yeah, that's great. Another question that came in from Spartanburg, South Carolina, was about keeping up momentum. So I know that you shared about how important it is to celebrate successes, how important it is to lift what's happening on social media, lift it up so folks can see. Any other ideas you have about keeping up momentum?
Yeah, so a couple things come to mind with that. One is just because you finish a project in a certain area does not mean you should be done with that area. So my first thought is continue to go back, continue to meet with those residents, continue to hear what their dreams are, because you never know what they're going to come up with that could inspire you to be able to do more, bigger, better things for that community. So the first thing is just continue to show up, continue to have conversations. Even if it's just, you know, there's a group of like 8 community members who meet for coffee every morning. Believe me, every community has that. So even if it's just sitting down once a month and saying, hey, I want to make sure I understand what's going on in this community, do that. The other thing, Erica, you kind of already mentioned this, but it's continuing to celebrate the good things going on there and highlighting what's going on. So, you know, I think about our different communities, they continue to make progress in so many ways, whether they're putting in small walking trails or adding playground equipment, whatever it is. Whenever they do that, we hold that up, because that is one more step of progress being made. And so we want to celebrate that. And so that's one of the ways we look at building momentum. And then what we found, which has been really great, is that when one of our communities does something, it kind of both challenges and inspires one of the neighboring communities to want to do it too. And so they're learning from each other, and the residents are working across town lines within the county to help each other. Because of, you know, what we learned on this fitness center in Moran, you guys can learn in La Harpe, and then, you know, and it continues. And so that's been really awesome to watch that happen as well.
Just sharing strategies and how-tos. You know, folks are always interested in the how. How do I make this happen? Yeah. Karen, I think I got at least a minute or two. I'm gonna
let's do one more.
Okay, let's do one more. And listen, this one should only take you a couple of seconds. Rebecca wanted to know, what are the demographics of Allen County?
So Allen County is, I'm not going to get it 100% right here, so apologies, but we are mainly a Caucasian county. We are 90-something% Caucasian. Our demographics vary more along socioeconomic lines, and that's where we see a lot of our equity issues. Is we were an industrial community, and as a lot of rural communities have seen industry decline, and then you start getting into cyclic poverty. And so that kind of is more of the makeup of our community right now.
Okay. Great. Thanks for sharing that. Again, I want to encourage you all to join the discussion group if we didn't get a chance to get to your question. And the other thing I will add is, some of you had some questions about strategy. How do I do this? How do I do that? If your question is not answered by coming to the discussion group, Karen will let you know how you can always connect with us later with community coaching, and just have maybe a one-on-one conversation to answer your question. So thank you for getting those questions in the question box. And Karen, I'm going to toss it back over to you.
Great, thank you so much. We just have a couple of additional resources that we wanted to share with folks to let you know how you might use some of the County Health Rankings and Roadmaps resources to really start to apply some of the lessons that we heard from Lissa today. So we have learned so much in our time together, and I really hope that you are leaving inspired to try some new ways to engage with residents in your community, or to recommit to things that you're trying to do but are struggling to get the buy-in to do. So as I said, I wanted to just share a few ways that communities can use County Health Rankings and Roadmaps resources to support their efforts to engage community members. So at County Health Rankings and Roadmaps, we work to support communities to bring people together to look at the many factors that influence health, to select strategies that can improve health for all and to close gaps, and to make changes that will have lasting impact. We do this by providing data, evidence, and guidance for communities. And then we also work to gather and share stories like the one we shared today of communities around the country that are at different points on this journey to serve as examples and inspiration. So I want to direct you to a couple of specific resources. One is some guidance that fits really well with our webinar today. The Partner Center which you can find under Take Action to Improve Health on our main navigation bar at countyhealthrankings.org. This part of our website is all about joining with others to make lasting change in your community. And it answers the question, who should we be working with? So if you think about that question that we started out with today, who might you want to be partnering with? This part of our website, the Partner Center, really can help you figure out how might you reach out to different groups. It provides guidance around why different groups might care about creating a healthy community, what they can do, and how you can engage them. Now, I want to encourage you to look at the community member guide in the Partner Center after today's webinar. I think that you'll find the guidance we have there will be a nice complement to our discussion with Lissa. So we will include this link directly to the community member guide in the slides and in the resources handout that will come to you in a few days after the webinar. But again, you'll find this in the Partner Center, which comes under Take Action to Improve Health on our main navigation bar. This is one of my favorites, the community member guide. The other thing I wanted to highlight is, excuse my coughing, as we learned from Lissa's story today about what's happening in the Harpe, one-on-one conversations with residents are a really powerful way to begin to build trust and lay that foundation for longer-term engagement. So this tool that we have from M&R called Understanding Resident Perspectives, a guide for one-on-one conversations, provides tips and some sample questions for getting to know people living in the community. Now, this tool was developed by Lori Frasina and Diane Pickles at M&R, and it was based on their experience working in a variety of communities. And they developed this guide to encourage organizational leaders to talk to and to gain insights from local residents. So this is a really helpful tool. Again, that link is right here in the slides, which are available on our website. This particular tool is highlighted in the community member guide, which I just talked about. We also want to let you know about our next webinar, which continues this idea of engaging new partners in creating healthy communities. So I encourage you to join us December 11th for Unlocking Potential, Engaging Young People in Community Change. Young people are key players leading community change to achieve greater results. So I would invite you to join our co-hosts from the Well-Connected Communities Initiative to learn how communities across the country are forming youth-adult partnerships to facilitate innovative ideas and to improve health and advance equity. And finally, I wanted to remind you that we are going to be going into a discussion group after today's webinar. We'll be meeting immediately after the webinar. I think Joe has chatted out a link for how you can connect. So we'll open up a Zoom meeting room. You'll be able to see one another and to talk with one another to explore strategies around partnering with the community. So I hope you'll plan to attend. Again, you can just click that link that you see in the chat box. You'll be asked a few quick registration questions, and then you'll be taken into the video conference. So as a reminder, this is an interactive face-to-face discussion that Joanne Lee from Healthy Places by Design will be facilitating. We encourage you to come in to use your video so that you can meet others and talk face-to-face and help build a strong network with one another. Now, our capacity is limited, so I'm going to encourage you to head on over immediately after the webinar. To help us start thinking about what we might want to be talking about in that discussion group, we want to take a moment to hear from you as we wrap up. What do you want to learn and talk more about? So James, I'm going to ask you to launch a poll to help us get some ideas from you about what you might want to learn about or talk more about with your colleagues in other communities.
And Karen, while people are responding to that, I will add that someone added in the chat about the good work that 4-H is doing and how they are connected with 4-H. So it'll be exciting to hear about what's going on with the well-connected communities next month. And I encourage that participant to join us next month.
Yep, that's great. All right. So we'll just give you a few more seconds here to respond to this poll. I can tell already from the results that I'm seeing here that it's going to be an interesting and lively discussion. So James, let's close the poll and share those results in just, there we go. All right, so you can see that folks are interested in all of the topics that we had listed there, especially interested in how to deepen existing partnerships with community members, looking at ways to connect with community members, using community conversations in your community, and building up the trust bank. So it sounds like folks have got a lot that they are ready to share, some additional questions to ask of each other. And I know that Lissa and Damaris will be there with us. So that's great. We're excited to see you in just a few minutes over there. I want to remind you of how you can stay connected with us. You can follow us on Twitter, you can like us on Facebook, and you can sign up for our e-newsletter. And I wanted to, highlight one thing before we wrap up. Erica had asked or had mentioned that there are ways that you all can connect with us if your questions weren't answered or you run into some challenges with some of those resources that we shared here at the end. At the bottom of our website, no matter what page you're on, there is a question that asks if you need help, if you want to connect with somebody. That is a great way to reach out to our team of community coaches, and we can be back in touch with you to help you figure out what your next steps are or how to make the most of the resources that we have available. So I want to highlight that as a way to get connected with us and answer any questions that you have about the resources we shared today. And finally, I'm so happy that we've been able to have Lissa Regier with us today. Lissa, thank you so much for sharing your story. So many stories from Allen County. It's just really great to learn from you and with you. So thank you so much for being with us.
Well, thank you so much for inviting us to share our story. We're so proud of Allen County, and we love to be able to share about it.
That's great. Thank you so much. And Erica, Joe, James, thank you all so much for your support today and your help with questions and chat. And we hope to see you all, or as many of you as who can join us over in the discussion group. Thanks much.